Hi, we are going to talk about the United States healthcare system. We are Ana Sofia, Regina, and Lilia Jimena. First of all, what is the healthcare system? It is a complex of facilities, organizations, and trained personnel engaged in providing healthcare within a geographical area. The United States healthcare system has both private insurers and a public system that covers the elderly and low-income families. Employer-sponsored private insurance is the main way Americans receive insurance coverage, and most services are provided by private providers. So, in all of this, what is the role of the government? The Affordable Care Act (ACA) established shared responsibility between the government, employers, and individuals for ensuring that all Americans have access to affordable and good quality health insurance. However, health coverage remains fragmented, with numerous private and public sources. And also, private insurance is regulated mostly at the state level. The healthcare system offers many services. The Centers for Medicare and Medicaid Services (CMS) administers Medicare, a federal program for adults from 65 and older and some people with disabilities, and works in partnership with the state governments to administer both Medicaid and the Children's Health Insurance Program (CHIP), a conglomeration for federal state programs for certain low-income populations. How is the insurance financed? In the United States, there are two types of financing. The publicly financing healthcare is the first one, where Medicare is financed through a combination of payroll taxes, premiums, and federal general revenues. Medicaid is tax-funded and administered by the states. States receive matching funds from the federal government for Medicaid at rates that vary based on their per capita income. The expansion of Medicaid under the ACA is currently fully funded by the federal government through 2017. And the second one is the privately financed healthcare, where private insurers, which can be for-profit or non-profit, are answerable to state insurance commissioners and subject to varying state regulation or federal regulations. Private health insurance can be purchased by individuals, but it is usually funded by voluntary, tax-exempt premiums, the cost of which is shared by employers and workers on an employer-specific basis, sometimes varying by the type of employee. Some individuals are covered by both public and private health care insurance. As I told you, the healthcare system in the United States offers many services. The first one, and the main one, is the primary care. Primary care physicians account for roughly one-third of all the U.S. doctors. The majority operate in small self- or group-owned practices with fewer than 5 full-time equivalent physicians. Practices often include nurses and other clinical staff. Patients generally have free choice of doctor. Physicians are paid through a combination of methods, including negotiated fees in private insurances, capitation in private insurances also, and administratively set fees in public insurance. And the other services are the outpatient specialist care, where specialists can work in both private practice and hospital. Some insurance plans require a referral by a primary care doctor to see a specialist and limit patients' choice of a specialist, while other plans allow patients broader and direct access. Access to specialists can be particularly difficult for Medicaid beneficiaries and the uninsured because some specialists refuse to accept the Medicaid patients owing to low reimbursement rate, and safety net programs for specialist care are limited. And here's where we see a problem because patients don't care about the health of the patients, they only care about if they are going to get paid or if they are going to get like a minimal pay for the Medicaid beneficiaries and the uninsured ones. There is also the service of mental health care. The mental health care is provided by a mix of for-profit and non-profit providers and professionals including primary care physicians, psychiatrists, psychologists, social workers, and nurses, and paid for through a range of methods that vary by provider type and payer. Most insurance plans cover inpatient hospitalization, outpatient treatment, emergency care, and prescription drugs. Other benefits may include case management and peer support services. And in here we have an organization of the healthcare system in the United States. In the public financing, at the top there's the federal government and the state government. And below we can see the Medicare and the Medicaid and CHIP enterprises that we have already mentioned. The private financing, at the top there's the privately insured individuals, which are employers and marketplaces. The Organization for Economic Cooperation and Development is an international forum committed to global development that brings together 34 member countries to compare and discuss government policy in order to promote policies that will improve the economic and social well-being of people around the world. Of the member states, the US and Mexican governments play the smallest role in overall financing of healthcare. However, public spending on healthcare per capita in the United States is greater than all the OECD countries except for Norway. And thank you for your attention. And here are our references if you want to consult them.